Okay, so there is no doubt that allergies have actually increased in prevalence, escalating to epidemic proportions and becoming more severe and complex. The heaviest burden of allergies is actually been noticed in children and young adults. Now, the socioeconomic burden of allergic diseases in general is also rising in countries worldwide, regardless of their economic status. Now, you wouldn't believe if I told you that up to 20% of the global population suffer from allergy. And the most common allergic disorders that commonly encountered include asthma, allergic rhinitis, food allergy, and atopic dermatitis. Now, although the allergic rhinitis and atopic dermatitis are actually more prevalent compared to other allergies or allergic disorders, the vast majority, if epidemiological studies, if you look at Google or PubMed or whatever, is actually related to asthma. So most of the study that you will encounter are actually related to asthma. Up to 70% or 75% of studies on the prevalence of allergies actually talk about asthma, while atopic dermatitis account only for 25% of these publications. And look at allergic rhinitis, which is more prevalent, more common than other allergic disorders. The prevalence on allergies is only about 16%. Okay, so for more than a decade, the relationship between all of these allergic disorders, be it asthma, allergic rhinitis, food allergy, or eczema, the relationship between these diseases has been sometimes referred to as a topic march. I'm sure you have learned or you have heard about the atopic march. And basically the atopic march in a nutshell that states that all allergic diseases may share a common ground, and that the and this cohesion or this relationship should be considered when we manage these patients. But this is not really uniformly accepted, and I think now we know that probably that's not really true, as more evidence coming up now that the a type of inflammation called type 2 inflammation play a critical role in all atopic diseases. So what is type 2 inflammation? Type 2 inflammation is really one of three inflammatory pathways. Type 2 inflammation is actually two important cells that are involved: the T helper cells or T-type 2 helper cells, and the innate lymphoid cells are the main cells that actually drive this inflammatory process. And there are 4 cytokines that are actually important. And these cytokines include IL-4, IL-5, IL-13, and IL-31 for helminthic infections. And it acts via mechanisms that engage the entire tissue, such as mucus production, contraction of smooth muscles, etc., that leads to actually expulsion of the parasite. However, since the parasitic infections are not very common currently, this system becomes redundant and dysregulated, leading eventually to the atopic disorders that we encounter in our clinical practice. This is in a nutshell. I'm not going to go into the details of how this happens, but this is in a nutshell, just to give you an idea. So now, there are multiple factors that contribute to the pathogenesis of type 2 inflammation, and these are summarized here. So the factors, but they are linked. You cannot dissociate them. They are linked, and they include immune response and inflammatory processes, microbial and environmental factors, genetic disorders and mutations, and I think this is an important factor, and barrier dysfunction, which is another important element of type 2 inflammation. And I think genetics and barrier disruption is really the key elements here. So you will not have allergic disease if you are not genetically predisposed. So that's when we talk about A to B. A to B is really a genetic tendency to develop allergy. This is the shortest definition of A to B. Now, the risk of developing allergies in offsprings have been looked at before, and in parents where no allergy is there, the history of so without parental history of allergies or A to B, the offspring chance of having allergy is about 17%. That goes up to 35% if a single patient parent is involved, and that goes up to 50% or more than 50% if if both parents are affected. So do you really need to choose our partners from the beginning to avoid allergies? Is that part of the allergy avoidance strategy, and something that it's a fruit for thought anyway? Okay, so there is no doubt that allergies are increasing, and we don't really know why. However, there are, I think, four important elements or four important factors that have been sort of thought about over the last events have played a role. Dietary factors. I mean, our diets have changed and evolved over the years, and again, with increased consumption of processed foods, with additives and preservatives and colorings have contributed to that as well. Increased exposure to environmental substances such as detergents, diesel exhaust, nanoparticles. But of course, death can actually happen because of the particularly in patients with severe disease. Okay, so, and again, this is again the cost and how based on disease severity, how asthma can be significantly a burden on most health economics. So if you can look at the right hand track there, or the bar that on the right hand side of your screen, you can see that the more severe asthma, the more costs to the health systems. Okay, what about quality of life? A lot of patients with asthma, of course, have problems with the quality of life, and this is a more recent study from our region looking at 134 patients, and you can see that first of all that all patients have poor health quality, and up to 70% of them have poor quality of life, and specifically those above 40 years of age, obese, female gender, family history of asthma, those who've had pets at home, and those with moderate asthma. So the worse or the more severe asthma, of course, the quality of life is affected even more. And of course, low socioeconomic class, low education, and higher smoking status. So asthma is actually a disease that causes significant health burden, not only on individuals, but also on the overstretched health systems as well. Burden of allergy. The second condition that I'm going to talk about briefly is allergic rhinitis. Allergic rhinitis actually is a very common disorder, and again, I don't need to actually introduce allergic rhinitis in this group. So it is basically inflammation of the nasal lining characterized by one of the following: itching, sneezing, nasal congestion, nasal blockage, and it accounts for about slightly more than 40% of all allergic types of rhinitis that we come across in the clinical practice. So it is a significant proportion of patients with health issues. Now, again, when we look at the worldwide prevalence of allergic rhinitis, we see that up to 38% across the globe would suffer from allergic rhinitis. In Europe, about 20, and this is an old study, about 23% are affected by allergic rhinitis. And if you look at the characteristic of allergic rhinitis, you'd see that most patients would have allergies to dust depicted by the purple color. The pattern of allergic rhinitis mostly intermittent, only about 48% persistent. But if you look at the lower panel there, you'd see that most patients would have a moderate rhinitis. So it is again a global health issue. Okay, again, this is back to the cost, and to basically look after a patient with allergic rhinitis, you need to spend about €1,000 per annum in Europe. So again, it's overstretching the burden of the disease on the health economics. Okay, so what about the impact of quality of life on these patients? Yes, it does really impact the quality of life. So this is based on a survey that was done a while back. So they've asked patients, how does actually allergic rhinitis affect your symptoms? And 41% said that yes, it does, restrict their social activity. And about 25%, it limited their social activity with pets, and up to 44% restricts participation in outdoor activities. So again, a significant burden of what we think is a minor allergic disorder. So it has really a significant impact on patients' quality of life. Now, there are two diseases that are commonly associated with asthma. One that we tend to see and look after. So the first one that is really associated with rhinitis is asthma. And this is a study that was done a while back, that up to 80% of all asthmatic patients have allergic rhinitis. And this is something that we sometimes miss. So a lot of patients actually with asthma have, if you dig deeper, you find that they have evidence of allergic rhinitis. Now, the problem is more in kids, and we know that actually if you treat allergic rhinitis, you have a better control of asthma, not only in kids, but also in adults. Now, this is our study on severe asthma, and that actually was done here, and I was lucky to be part of it. And we, in our severe asthmatics, and again, this is closer to what the literature say about the association or the association of allergic rhinitis with asthma. And in our cohort of patients, up to 65% had severe allergic rhinitis. But again, we had to dig deeper. I think the percentage there is minimal. I think the number is higher if we actually looked more carefully. Now, the other forgotten clinical association with allergic rhinitis is allergic conjunctivitis that we tend to ignore. And this is very common, and they can be present in up to 75% of patients with seasonal allergic rhinitis. But it's often a forgotten aspect of care. So is there a way that we need to do to prevent or reduce allergic diseases? The simple answer to that is probably not really. We don't really know how to reduce allergies, but maybe if we choose the right partner, maybe the one with no allergies, that may contribute to a reduction in the prevalence of allergies. Pregnancy, or when the patient is pregnant, maybe healthy, balanced diet, and pro-antibiotics, vitamin D may be important. And when the baby is delivered, maybe perinatal and in early infancy, healthy, balanced diet. Breastfeeding is important. When the old kids are older, maybe healthy diet and, raw and prebiotics. But again, the reason, how to reduce allergy is really difficult, and it remains an unanswered question and an unmet need. With that, I leave you.